Next, we'll move into the topic of sexual health, a subject that is often sensitive and sometimes overlooked, but absolutely essential to overall quality of life. Open, age-appropriate conversation empowers patients and families to navigate these challenges with knowledge and confidence. We've arranged a joint panel with Doctors Lily Hayes, Jenn Moore, Megan Dakhlian, and myself to discuss sexual health. We'll follow this session with a breakout group and an anonymous Q&A panel.
Really seeing a lot of us this morning. So thank you, Ted, for that introduction. The inspiration to want to bring this up as a topic is actually an acknowledgement that we probably as providers can do a better job at incorporating this into our discussions and care with patients and families. So we're going to talk a little bit about, some ways to discuss this, or even really, I think if the only outcome of this is that you start to think about this topic of sexual health and maybe think about bringing it up with your team, then that would be like a really great goal to accomplish. So question is, why is sexual health important to talk about? So as we all know, sexuality and intimacy are a normal part of our lives. It's a normal role that we play or that we have. And I think that like as we are trying to figure out how to help your child's like bladder and bowel functioning, there's a lot of focus on like the medical management. And sometimes it can medicalize our anatomy as well. And many, or even maybe most individuals, desire romantic relationships and intimacy. And, some may be growing with the thought of like, of course, I'm going to have that someday. But there are definitely some people who I think worry about, will someone accept me? Will someone, want to be intimate with me? Or how will I even talk to them about this when the time comes? Or what does this look like for me? And one thing that we've heard, as I mentioned before, is that I think some patients and families have talked about this being a gap of something that we just like don't talk about as much as we could be. And I hear this a lot, that parents are often kind of wondering like, how do I even talk about this with my kids? And we know that caregivers worry about how their child's relationships will be affected, right? We hear parents say all the time, like, I want that for them. I want them to be in a relationship and feel confident. But there can be a discomfort with having this topic, and that can be true, especially if you've tried to have this conversation and your kids are like, ew, don't talk to me about that, right? Which I'm sure some of you have had. I see some smiling faces. So, and then, if this isn't something that you've really like talked in depth about with your team, you may also not know, like, how do I approach this conversation? And so I'm going to include like some quotes that we, actually like some things that I've heard, or at least similar to, we'll probably talk about it as he's on the way out the door to college, or he's only 8. I'm hoping it will come with time. Or I know we have to talk about that, but I don't know how to help her. I don't even know where to start. And one thing we also know is that many medical conditions that affect anatomy, including bladder exstrophy, can lead to anxiety about relationships and about intimacy. And so, as I highlighted before, like if an individual is feeling like, oh my God, I've never even told any of my friends about my bladder exstrophy, or like they don't even know that I cath. How am I going to talk to like my boyfriend about it? And when do I do that? Right. And so what can happen is that some individuals may choose to avoid relationships altogether. It's like they don't want it to progress to that point so that they can just avoid that challenge or that discussion. And we, I think I wrote there's hope because one thing we also hear is that as people get older and they own it and they are confident in who they are as they mature, they worry less about this, right? So then the narrative ends up shifting to, Well, if they don't like it, they're not the one for me, right? Awesome. But that's another way that like we can help inspire kids to really feel confident about like who they are, so that this is not something that they're worried about someone not accepting. And that many people with bladder exstrophy have healthy relationships. They get married, they have satisfactory intimacy, and they have kids, as we've obviously heard from lots of people here today. So thanks for hearing about why it's important. I'm going to pass the baton to Ted to talk about how bladder exstrophy does actually affect our anatomy.
So I'll be speaking about bladder exstrophy anatomy. This is a generalization. It comes in a huge spectrum. But if you look for male anatomy of the penis from the feet to the head, you can see that on the left and right side, most laterally, the pubic bones are separated. So if you feel kind of below your belly button, above your genitalia, you should feel a bone. If you don't have bladder exstrophy, that's connected. But in bladder exstrophy and often in epispadias, those bones are separated. And with that separation, what happens is that the penis, or what you see on outside the body, is not the only part of the penis. The other half, or maybe even the longer part, is actually inside the body. And as that bone separates with growth, you can have less anterior penile length. So there is some of this with birth, in that males with bladder exstrophy and epispadias have shorter anterior length penises to begin with, but with that pubic bone separating, it can even cause less length anteriorly. And if you look at the body from the sideways view, oftentimes the penis tends to curve upwards towards the belly, and that could be due to skin tethering, but oftentimes it's because of that hollow structure that I drew above the testicle. That structure, the corporal bodies, or what I think to be the penis, can be curved, and it can be also, you have two structures, the left and right, that I outlined here. And one corporal body might be longer than the other, which can result in a lot of twisting, in addition to the curvature. So we're going to talk about the anatomy for female bladder exstrophy and epispadias patients. And from the outside, again, now we're going back to the feet up view. If you're looking at the skin and the outside, there's a vagina, and the cervix is the barrier between the vagina and the uterus. Sometimes, and I would say 20 to 30% of the time, patients with bladder exstrophy may have a little bit of tightening at the inlet of the vagina, which can cause some pain with intercourse. And also another component that's, I think, is important, this is a sideways view, in that during sexual intercourse, a lot of women experience stress incontinence or urinary leakage during intercourse, which can embarrass a lot of our patients.
So continuing along the lifespan, you might see your friendly physical therapist again, talking about sexual health. And really, when we think about for physical therapy and sexual health, I think understanding and knowing what your anatomy is so important. And so Dr. Hayes really highlighted why we want to be talking about this early on. And as Dr. Lee talked about, that sometimes the anatomy might be a little bit different. And so for anybody, any child, really early on, we should be thinking about, talking about, and using normal anatomical terms for what our body looks like, so that as we get older, it's easier to talk about. So we want to normalize it early. Even if you're not ready to talk about sex, we still want to know what our anatomy is, know what our anatomy looks like, and have vocabulary so that we can talk about it. And this is really important when you're thinking about empowerment and education. So when we do get older, we want to talk about sex, we're ready to have sex, we can really think about and understand that. And really pulling in, thinking about from a physical therapy perspective, there's ways that we want to think about. Sometimes it's not always penetrative sex. So there's other ways, especially if there are challenges with pain, that we can kind of talk through and help support if whether there's pain, there's some muscular tightness. Sometimes if we're worried about pain, our muscles can get really tight too. And so how can we work on stretching techniques, altering position, or being able to think about what might be other forms of pleasure so that you can still have a meaningful relationship with an individual. So all of these things can come together as we're thinking about from a physical therapy perspective, to be able to optimize the experience and have it be a positive experience. And really from a physical therapy perspective, if there is certainly any continence issues, that's going to be a big thing that we're going to want to focus on, because that can be a challenge when you're trying to be intimate with somebody. If there is muscular tightness or any contractures or any weakness, there's certainly things that we can be working on from a physical therapy perspective. Really being able to talk through, as I had mentioned, what might be optimal positioning to support that experience. And if there are challenges with pain or sometimes having that anticipation of what that experience is, how are our muscles tensing up? And really, what can we think about from breathing and relaxation techniques in order to prepare to have that positive experience? And I did include a link here. So as we're getting into more sexual health focus, you may be able to kind of shift from a pediatric pelvic health therapist to a more adult-based pelvic health physical therapist to find some support. And there are some more availability of trained pelvic health therapists. So I did include a link from the American Physical Therapy Association Pelvic Health that does list different adult providers that are trained specifically in pelvic health. But as with anything, you certainly want to make sure that you're talking about, what that means for you. All right, and then I'm going to keep passing it along.
Okay. So we're socialized from a very early age that genitals are not to be discussed and need to be concealed. Yet, many times, these kids are subjected to several genital exams, extensive urogenital exams, much more so than their same age peers are. And then the rarity of the condition can also make some feel like they're on display almost in front of other providers, and maybe if there are more trainees in the room. So then there's also the association of pain with the genital region from the surgeries, and that complicates an area that is really supposed to be one of function and pleasure. And there may be some functional limitations related to specific sexual goals. So this is a slide that is really dedicated to Brené Brown, because if you have any interest in shame and shame research and shame literature, she is really the person to look to for that. And she has many books kind of on this topic. But in general, shame is an intensely painful belief or feeling that there's something wrong with us. Some of the components include social comparison, where we're perceived to be inadequate in some way. There's a sense of otherness that we internalize, feeling separated from, disconnected from others, defective, alone, unique in our suffering, unworthy of love and connection, and a strong anticipation of rejection, pity, or unwelcome fascination. Shame is universal. So how do we address shame? In this population, it's especially important to have accurate biological understanding that normalizes variations in individuals and takes the judgment out of these variations. It's no one's fault. There's no values or judgments that should be associated with it. Realizing that you're not alone and that you're part of a community. I mean, what a fantastic example of that today. Just amazing. Having self-compassion allows us to reach out for connection, and sharing vulnerable parts of yourself with someone else and receiving empathy and acceptance are really key to moving through this. So just as a distinction that some actually have started to already make today. So sympathy is feeling for someone, kind of a poor you, situation, but can actually magnify those feelings of being alone or kind of otherness, whereas empathy is forming genuine connection and acceptance feeling with somebody. And, you know, maybe also, even if it might not be the same situation, maybe some me toos in terms of different thoughts and feelings that people have. So how do we decide how to share with others and really seek out that social support, especially outside of the bladder extrophy community? So this makes up a lot of the talks that we have in our clinic in terms of how to share information with others. So oftentimes I encourage people to think about someone who already kind of confides in you. So there's that shared vulnerability that you have about other kinds of issues and topics, someone that you seek support from and who's known to kind of have your back no matter what, someone who keeps confidence of others and doesn't gossip. If you have a friend that you feel very close to, but you know that they gossip a lot or talk a lot about other people's more personal business, that might be someone that you want to hold back on sharing with. You want to talk to someone who is a good listener and is able to display empathy, and then someone who is open and tolerant of differences in others, or just open to different ways of thinking. So when considering, again, kind of this privacy versus secrecy dynamic, and we don't ever want it to be a secret, but recognizing that it is your private medical information, consider for yourself, what would the potential benefits be of telling this person, but also what would the potential costs be of telling this person? What information would be best to share, recognizing that it doesn't have to be an all or none approach. You can share as much or as little or none as you want. What do you predict their reaction to be? And again, some of that is probably based on some prior conversations and interactions. And how confident are you in this prediction? So in terms of romantic and sexual relationships, the information sharing is really about peers, extended family members, coaches, teachers, whoever that may be. And then if we narrow in a little bit more to relationships, it's important to note that everybody is nervous. Everyone is focused on their own perceived inadequacies. And so it's important to get out of the mindset of a sexual relationship as just intercourse. There's many different ways to experience pleasure and satisfy your partner. And most men and women with bladder extrophy and related conditions are in long-term relationships. Although some research suggests that they may end up starting sexual relationships a little bit later than peers. So a solid relationship and communication are some of the keys to building on that relationship and then building to a sexual relationship from that strong relationship. So comfort with your own body and what you like and what feels good. You have to be comfortable with your own body before you can share it with someone else or experience shared pleasure with someone else. Mutual consent. There has to be a willingness to be open and honest about your boundaries, their boundaries, what their expectations are, what your expectations are, and any concerns that you may have. Ultimately, a foundation of trust and respect is key, and you want to make sure that both of you can be patient and flexible, exploring new and different ways to connect physically and emotionally. And so along those lines, here's a couple just quick and dirty dating tips, I guess. So some good ideas for shared activities together that, again, can kind of build that relationship, build that comfort and support. So learning something together, taking a class together, doing something together where you're both learning something new, doing some kind of meaningful work together. So whether that is a volunteer opportunity, or something else that you all find meaningful, that can help to really strengthen a relationship. And then also recognizing that, adrenaline can lead to arousal. So this is sort of a Psych 101 kind of experiment sort of thing. But if you take someone on a date where you are increasing their adrenaline, so think about like a roller coaster ride, a haunted house, a scary movie, kayaking, anything where you're increasing kind of your heart rate, your work of breathing, your arousal is up. So there's a phenomenon called misattribution of arousal, where the other person will sort of potentially interpret those strong physiological feelings to being next to you, and that's a good thing if that's what you want. So that can be a nice tip and trick for dating.
I'm so pleased that over the course of the day, I feel like a lot of these messages are being reiterated. So I don't want to be repetitive, and I won't necessarily read every word on this slide, but I'll use Emily's driving analogy, that, this really can start from an early age, and it doesn't have to be talking about sex. I feel like I was talking about this with someone and they were like, that's crazy, talking about sex with a baby. Like, no, obviously, but we can start by teaching them the normal terms for their anatomy so that these conversations are easier later on. And you can teach about safety and what is appropriate touch. And as parents, you can also model healthy relationships for your child so that they're watching you and learning from you. And then of course, as a child is growing up, especially around puberty or even in middle school, they start to, at least, it may be state dependent or country dependent, but they start getting sex ed at school, right? This is another opportunity to bridge the conversation and continue it at home. And you can encourage openness to asking questions within your family, but also with your medical team, so that even if your child is giving you that ew, don't talk to me about it, maybe you at least can model that for them and show them that this is okay to talk about and comfortable. And that whenever they're ready, they can also meet with their doctor on their own. And some people really do take advantage of that. And they're able to have that ability to ask questions, or talking about youth rally, right? I know that this is a topic that you talk about. And I'm so grateful for that, because it can feel so different talking to a peer or someone a little bit older than you versus talking to your parents or your doctor. I see some nodding, so I'm glad that's consistent. Yeah. And then as someone, especially as they're approaching adolescence or young adulthood, right? We always are continuing to open the conversation and open the door to it. But as somebody is intending to be sexually active, you can also normalize conversations about contraception. And again, expand the idea that intimacy doesn't only have to involve sex. So this really is over the course of the lifetime goal. Caregivers are educational partners. And there is research that shows that adolescents who discuss sexual health with their parents are more likely to use safe sex practices. And as caregivers, you can also integrate your family, they may be, within these discussions. And if you are stuck, if you're that parent who's I know I need to talk about this, but every time I try, they're really don't want to talk to me about it. Or I don't even know what to say, we can all be partners with you. I typed ask your urologist, but hopefully you have a team of people who are there to support you with those conversations. And then connection to group organizations like Youth Rally. Again, obviously I think you're a testament, thank you to you both who spoke about that earlier. But it's really a great way for your child to learn and ask questions to people who know what they may be going through, or maybe would have questions about. And, it's worth noting, there are some families who are I could never talk about this with my child, right? And that's okay. If that's where your comfort level is at, then even better to connect your child with people who can talk to them about it in an appropriate, an appropriate way. And then as you know, the reason we included a lot of this education about anatomy is because it is so important, in my opinion, for someone to understand their anatomy in order to like help them understand what they need to do, right? As Megan was talking about positioning, or how to like even keep their bodies healthy. Like, do you need to calf beforehand, right? Or, you know, calf after? Those are things that can actually empower somebody to know what to do in those situations, and then also can reduce anxiety. And then obviously, like if we're normalizing the discussion about it as your child is growing up, then it also allows them to talk about this with their team, if they are having issues with sexual function and satisfaction. Thank you so much for listening to all we had to say.
Okay, so we're gonna start our question and answer
And thank you for
session.
coming up with that question too, because that's
So some very thoughtful questions. You know, one of the things that I get a lot from parents, one of the questions I get is how do I my child compares his or herself to his or her sibling quite a bit in terms of toilet training, but also genital appearance. What are your thoughts about counseling parents? What is the best method? What age to do so?
I think. I don't know how to turn them on. Oh, here, this one's working. This one.
Okay, sorry. So I think kind of the first general step that's good and helpful for everyone is just to normalize differences, to do like some really good socio-emotional development with kids early on, where you're normalizing all kinds of differences in people, whether it's skin color, whether it's height, whatever it may be. And then that helps to set up, you know, future discussions where if a difference is noticed and brought up, that we just, you know, note it as a difference. And it's again, removing that kind of value or judgment from it. It's just a difference, just like, you know, there's other differences between you and your sibling.
And I would just add too, like, is depending on, you know, if they're potty training, I don't know if they'll be able to conceptualize this then, but as they get older, right, then I think it's definitely important to talk about like the differences in their anatomy as it does relate to their extrophy, just so that they are aware, you know, and again, like as we discussed, knowledge is power, and I think reduces the stigma too.
Another question is spouse mate involvement in counseling encouraged or provided when it comes to addressing concerns surrounding intimacy?
That's a great question too. I would say, yeah. I mean, I'm looking to Jenn too to see what she thinks, but you know, there may be like your spouse may even come to your medical appointments with you. They may have some questions and want to ask some questions. And certainly if sexual or sex or, you know, intimacy has been like a challenge in some areas, then I think I would definitely encourage a conversation about it.
I totally agree. And we've had a number of like really helpful conversations when individuals have brought in their partners. More often, at least in our clinic, it's usually a boyfriend or a girlfriend. Typically, we're not seeing individuals who are necessarily like in their later 20s or early 30s or things like that. So I think too, you know, one of the challenges that we have as pediatric psychologists is that we are trained in, you know, having these emerging conversations and things, but our training and our background is different than that of a sex therapist. And so also kind of knowing how to facilitate those conversations, but then also when to refer for kind of more in-depth conversations about logistics around things and kind of ongoing therapy and support.
I was just going to add above and beyond from the counseling perspective too. I think when there are physical challenges, whether it be pain or difficulty with intercourse to, if someone's working with a physical therapist, I think that can be a good opportunity to include, your partner in those conversations. So if it's, hey, this is really painful for me, let's talk through some strategies where we can make it so it's more successful, or, prepare my body so I'm a little bit more ready for this. So I think on many layers, being able to incorporate your partner in those conversations.
So I see a lot of patients coming to seek counseling, second opinions about genital surgery, especially for men, with regards to curvature and penile length. And oftentimes they're accompanied by their partners. And I often find that their perception, or the patient's perception of their genitalia, is quite different from their partners. When I ask the patient, how do you feel about it, your anatomy, and the patients are, well, just, I don't, it doesn't feel right, it doesn't look right, but the partners look me straight in the eye and say, I don't have a problem with it. So that's something I think super important to discuss. I think another part of it is that the truth and honest answer is that providers need to learn how to talk about this. I'm a young provider. I felt pretty uncomfortable talking about it in the beginning of my practice, but this is something I'd make a conscious effort to talk about with my patients starting at an age-appropriate age, which frankly, I think it's around 7th, 8th grade where I really start talking about it and tell patients to think about it, write questions down, and I take my time, and you learn. As a provider, we learn as well. So I think that it's something you build trust over a long period of time with yourself, your provider, and your partner. I think as you become an adult, it's important to seek counseling with sex psychologists as well, which they're highly prevalent, and they could be very helpful. As urologists, we often counsel patients with erectile dysfunction, et cetera. So the resources are out there. Okay, I think this is a super important topic in the world we live in. Online pornography can set an unrealistic standard for what to expect in the bedroom for bladder atrophy patients. What are your thoughts on consuming such material?
I'm glad someone brought that up. I was thinking about that as Ted was talking, because we've had these conversations among us that, pornography can set unrealistic ideals, or you think that's how you need to look. The reality is, as Jen mentioned earlier as well, there's a lot of variation, and with a lot of social media, right? This is like not always the reality of how people look. And so that's what I'll say to that.
And, it can be a good and healthy way as you're learning to explore your body. And so, it doesn't have to be dismissed outright, but I think there always needs to be a conversation with adolescents and young adults when they come to the clinic to have a better understanding of where some of their questions are coming from and sort of what their reference point is, because oftentimes that is their reference point. And while they may know that it's unrealistic, I think it's helpful to kind of reinforce that as well.
For me, this is something I do. Right after I do exam, I ask kind of parents to step out, and I actually say, hey, I actually just say, I know your friends are talking about this. I know people are sharing photos and videos, and in pornography, when you watch these videos, that's not realistic. No one has intercourse or relationships like that. And I say this, and the kids, I don't ask them questions or ask them to answer anything. I just say it. And I say, all the relationships is not having, I would say loving relationship does not equate having this type of intercourse that you see in videos and images. And I just kind of say that out loud. And then I kind of don't ask questions because kids are usually pretty quiet when I say these things. But I think it's important that somebody says it. I personally don't think it's fair for us to ask parents to talk to their child about sex. I mean, I think as a parent, you can do that, but for a provider to ask the parent to have that discussion is a little, I think that's asking a little too much, because I would have never want to have that discussion. So I think peer support is so important, and we at Boston Children's, we do have support groups a couple of times every year. And that's been going on for a very long time. And one of the things that we discussed during the session was like, what should we do? How do we talk about sex? And a lot of our young adults said, going to youth rally and talking about this with other peers who have a similar situation was really helpful. So I think that is a essential component to this kind of discussion. Next question that is here is, I cannot access physical therapy in a local place. What are some resources that I can obtain to do physical therapy at home?
That is a phenomenal. Is this working? Yeah. That is really a phenomenal question, and it is certainly a barrier. What I would say is to make sure you're having those conversations with your teams and your providers, because they may have some connections and resources. Oftentimes, it might not be regular ongoing physical therapy, but if you're traveling to meet with your providers, you can coordinate a visit with a physical therapist, often that works closely with the bladder extrophy team. And they might be able to set you up with a bit of an individualized program. Often, sometimes we can do some outreach to local providers that maybe don't necessarily have quite the specific training, but we might be able to talk through and support them with a program. So I think being able to connect with your providers, your medical providers, they probably have a PT that they work closely with, and trying to connect with that resource to navigate, but it is certainly a challenge right now. Right?
So the final, I think, question is something that it's a tough question. Pam Artigas and I, we were just discussing a girl that they are taking care of in India, whose parents essentially kind of have neglected her because they don't think she's marriable. And one of the questions that was asked here, and then you kind of say, you hear those anecdotes and you're like, that's so third world country and unrealistic. But we got a question here, which how do you help parents who feel their child is unlovable because of their condition? My mom, truly meaning well, also perceived me as an unlovable child by a potential husband, and always told me as I grew up, you will never marry. No one will ever love you. So that's a heartfelt question. I think parents want to protect their children, and in doing so may kind of say these things preemptively. What are your thoughts about that?
I mean, my honest first reaction is I'm sorry that you ever thought that, and it's not, in my opinion, true at all. I hope you know that you are extremely lovable for who you are. I think that in reality, that's probably something that takes time to learn as you grow older, right? And I hope that you've found some friendships and other relationships, whether that's like with a partner or even just a friend or another adult, or that has helped shown you that. I'm not sure if the question was like, how do I talk to parents about that?
I think
Or
I
it's-
think it's just a
A-
platform to discuss that mindset and I mean, as a parent, I obviously don't agree with that, but I mean, you love your child, period, and you just want to protect them. And I think that I think it's important as a parent to also discuss with other parents and find support, because you're going through this too, not just your child. So we'll end on that note.